Okay, thank you for your patience. We had some difficulties, technical difficulties hooking up to everybody online. So this is Mayor Ken Tedford. I'd like to call to order the Central Nevada Health District. And at this time, if you'd all rise and we'll pledge allegiance to the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Ms. Moore, if you could take roll, please.
I'd be happy to. Chair Ken Tedford,
Here.
Shannon Ernst,
Present.
Justin Heath, Bob Erickson,
Here.
Denise Ferguson,
Here.
Tyson McBride,
Present.
Larry Rackley,
Here.
Jeb Rowley,
Here.
Rich McKay.
Here.
Okay, thank you. We'll go to item 4 on the agenda, which is for public comment. Public comment must be general in nature, not relative to any item on the agenda today. Discussion can be held, but no decision can be made. Is there any public comment? Mr. Clifford?
Yes. Good afternoon, Mr. Chairman and board members.
It's right there. There you go.
Oh, sorry. Good afternoon, Mr. Chairman and board members. I'm Bob Clifford from Fallon, Nevada, for the record. I'm here because I'm very concerned that the studies and data no longer support the official narrative and recommendations from the federal government, the CDC and FDA and everybody at the federal government. They're contrary to the actual science. Mind you, they're not what they call science. What they call science was, you know, hey, I'm Fauci and I'm science. Well, BS. You know, you have to actually look at the studies and the data and that kind of thing. Yeah.
There we
My
go.
apologies.
That's all right.
Anyway, you know, and it's now come out that, you know, all dissenting views during the pandemic were censored, and, you know, they were meeting with the big tech to censor social media, and the whole thing, you know, was set up so they could say whatever they wanted, and there wasn't any dissenting view, and that's not science. That's tyranny. So, you know, the federal government cannot be trusted. Nothing that they recommend should be accepted on blind faith. You have to do your homework. So I compiled a list of articles just that I've read in the last 30 days. So you can scan through there and get an idea. Most of the articles quote valid valid scientific studies and valid public data and things like that. And, you know, I think you need to do your own homework. You know, I think you need to personally exercise due diligence. You cannot rely and just say, well, the CDC recommends this. That isn't going to fly, both legally and in the mind of the public. You could come, you know, the public could come back on you later and say, why didn't you really look at what was going on? There's 5 pages of links. You're going to need the file to click on the links. There's no way you're ever going to type them in. And I assume Pam can take care of that. So from what I see, very few, if any, vaccines should be administered from this point forward. And if offered, they have to be offered with fully informed consent. The newest vaccine has virtually no safety data. I think they tested on 23 people. That's nothing. And, you know, and yet they're still operating under an emergency use declaration when there is no emergency. you have to disclose that to people that you're going to give the vaccine. You can't just say, oh yeah, federal government recommends it. So vaccine mandates should be out of the question. There should be no mask mandates, no shutdowns. Look through the articles in the handout, and I think you'll see. And then I would recommend, reading at least some of those articles. It really, really is eye-opening. And I thank you for your time very much.
Okay, thank you, Mr. Clifford. We'll attach your comments to the minutes. Any other public comment? Being none, we'll go to item 5, verification of the posting of the agenda.
Pam Moore, for the record. Brittany posted the agenda on September 7th between the hours of 8 and 12 at the locations listed on the agenda in accordance with statutes.
Okay, thank you. Item 6, consideration and possible action, approval of the agenda as submitted or revised.
Mr. Chairman, I would move that we approve the agenda as submitted and posted.
We have a motion, do we have a second?
A second.
We have a motion and a second, all in favor?
Aye.
Aye.
None opposed? Motion carries and the agenda has been approved. We'll go to item 7A, consideration and possible, we did 7A. No, we're at 7A right now. The consideration and possible action concerning the minutes of July 13th, 2023, regular meeting minutes. Does anybody have a correction or additions to those minutes? If not, I entertain a motion.
Larry Rackley, for the record, I didn't see anything wrong with them, and I move for approval.
We have a motion, do we have a second?
Shannon Ernst, I'll second.
We have a motion and a second, all in favor?
Aye.
Aye.
None opposed?
Aye.
None opposed, motion carries. We'll go to item 7B, the consideration and possible action to approve the minutes of August 10th, 2023. I'll entertain a motion to approve.
This is Shannon Ernst. I'll make a motion to approve the minutes from the August 10th, 2023 regular meeting.
We have a motion, do we have a second?
This is Denise for the record. I will second.
We have a motion and a second, all in favor?
Aye.
Aye.
None opposed, motion carries and the minutes of August 10th have been approved. We'll go to item 8, under appointments. Item A, consideration and possible action concerning approval of confidentiality and data sharing agreement between the Central Nevada Health District and the School of Public Health, the Nevada Institute for Children's Research and Policy, the University of Nevada, Las Vegas. Is Caleb on the phone? And
Yes, sir, I'm here. Can you hear me?
yeah, I can hear you great, Caleb. Thank you. Good to hear your voice.
Good to hear yours. Good afternoon, Mr. Chairman and board members. This is Caleb Cage for the record. This agenda item, this agenda item asks the board to consider the approval of a data sharing agreement between the Central Nevada Health District and UNLV's Nevada Institute for Child Research and Policy. As it says in the agenda report, the NICRP has received a CDC grant, and a part of that grant is that they have to provide tracked data within the state of Nevada to the CDC, which this collaboration with the Central Nevada Health District would be the CNHD providing de-identified aggregate data to the University of Nevada, Las Vegas on a quarterly basis as a part of their report. And this is specifically dealing with lead poisoning prevention and the lead poisoning prevention grant that they have received. So it would be data regarding de-identified aggregate level data regarding levels of lead in blood that is tested within Central Nevada Health District. Included in this report is a copy of the agreement, and all of the aspects of it. I'm happy to answer any questions or track down further information for you.
Any questions of the board for Caleb? Any questions of the public for Caleb? If not, back to the board for discussion and/or motion.
This is Shannon Ernst for the record. I make a motion to approve the confidentiality and data sharing agreement between the Central Nevada Health District and School of Public Health, Nevada Institute for Child Research and Policy, University of Nevada, Las Vegas.
Do we have a second?
For the record, Larry Rackley, I'll second.
We have a motion and a second. All in favor?
Aye.
None opposed? Motion carries, and this agreement has been passed. We'll go to item B, 8B, consideration and possible action, approval of an interlocal contract between the state of Nevada acting by and through its Department of Health and Human Services Division of Public and Behavioral Health and the Central Nevada Health District relating to Community Health Services Program. Do you have it, Joe, or does Caleb?
I guess since nobody else is talking, I will.
Okay.
So this is an interlocal contract agreement. Joe Sanford, Deputy District Attorney for the record. Mr. Chair, this is an agreement between the state of Nevada and the Central Nevada Health District to provide community health services. In particular, the state will be providing a registered nurse in Lovelock, Fallon, and Hawthorne, as well as an advanced practice registered nurse for family planning and reproductive health services at our clinics, as well as associated billing and that type of work. The health district will be providing appropriate facilities for that work to be done. If you have any questions, I'd be happy to answer them.
Any questions of the board for Joe? Any questions of the public? Back to the board for discussion or motion. I'll entertain a motion.
This is Denise Ferguson. I will make a motion for the approval of the interlocal contract between the State of Nevada acting by and through its Department of Health and Human Services, Division Public and Behavioral Health, and the Central Nevada Health District relating to the Community Health Services Program.
Do we have a second?
Mr. Chairman, Bob Erickson for the record. I second the motion.
We have a motion and a second. All in favor?
Aye.
None opposed? Motion carries, and this contract has been approved. We'll go to item 8C, consideration and possible action concerning ratification of an agreement between the State of Nevada Department of Public and Behavioral Health and the Central Nevada Health District in the amount of $32,487. Shannon.
For the record, Shannon Ernst, Churchill County Social Services. So the Central Nevada Health District applied for a sexual risks avoidance education grant. Really is what this provides is education on abstinence across the region. This grant will provide for the training materials and staffing. One of the biggest things with this is it was from July 1 through September 31st, and as you can see, it was just executed. So in this grant, it'll only pay for the purchase of the curriculum and the equipment. There will be a new grant agreement coming before you to start October 1. If there's any questions, I can answer.
Okay, any questions for Shannon from the board or the public? Being none, back to the board for a motion.
Mr. Chairman, I move that we ratify the agreement between the State of Nevada, Department of Public Health and Behavioral Health and Central Nevada Health District in the amount of $32,487 for funding to provide for sexual risk avoidance education program.
We have a motion, do we have a second?
I'll second that motion, Larry Rackley.
We have a motion and we have a second. All in favor?
Aye.
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 None opposed? Motion carries, and the agreement has been ratified. We'll go to item 8D, consideration and possible action, ratification of a contract with Liberty for malpractice insurance on Kathleen Patterson with a policy premium of $779.25 per year. Shannon.
Again, for the record, Shannon, Sturgill County Social Services. So with Kathleen Patterson coming on as the APRN to provide family planning services to Central Nevada Health District, we needed to bring on her malpractice insurance. We were not able to apply for the insurance until she did start, but we were able to get that applied for and approved and backdated for her hire date for the total amount of the $779.25 per year. So this is asked for a ratification today, so that she can provide those services. Any questions I can answer?
Any questions for Shannon from the public or the board? Okay, I'll entertain a motion.
Mr. Chairman, I'd like to move that we approve ratification of malpractice insurance for Kathleen Patterson from Liberty Surplus Insurance Corporation in the amount of $779.25 a year.
We have a motion, do we have a second?
Larry Rackley, I'll second.
We have a motion and a second, all in favor?
Aye.
None opposed, the motion carries and the contract has been ratified. We'll go to item E, consideration and possible action concerning job offer to Darren Winkleman as the Central Nevada Health District Administrator at an advanced step placement of Step 6. Joff?
Good afternoon, Mr. Chair, members of the board. For the record, Joff Stark, Human Resources Director for Churchill County. Here this afternoon, as you are aware, we have been recruiting and going through that process to select an administrator for the Central Nevada Health District. We did post the position. We had good applications, actually. We ended up with 4 candidates that we ended up interviewing. And through that process, we felt it was our determination unanimously that Darren Winkleman would be the best choice to head up the Central Nevada Health District. Some of you may be familiar with Darren. He's been working for us for a couple months now in a different role. And so he would move up, if approved by the board, he'd move up to Step 6 of the pay grade, as indicated in the agenda report. And we would have that go into effect on September 18th, 2023. As the board, I believe, is aware, this position does serve at the pleasure of the board. And so we want to make sure we're seeking board approval before that appointment goes into effect. Darren is here if you have any questions for him, and I can also answer any questions you may have.
Okay, thank you, Joff. Does the board have any questions for, you know Darren, he's been here for a while, so do y'all have any questions you want to bring Darren up and ask him? Anybody on the phone want to question Darren at length here? Okay, if not, any questions from the public? Okay, we'll go back then to the agenda, and the job offer is there for you to ratify the decision to offer a job to Darren Winkleman as our district administrator for Central Nevada Health District.
You ready for a motion?
I'm ready for a motion.
For the record, Larry Rackley, Mr. Winkleman, in my working relationship with him, he knows rural Nevada. He's already a health district employee. His experience and knowledge, he works well with the people. I saw that firsthand. And I would make a motion to approve the offer of the Central Nevada Health District Administrator position to Darren Winkleman at Step 6, Grade 77, effective September 18th.
Would you amend that to say the Step 6 at grade 77 at $115,710?
Oh, okay.
That dollar
Amended
amount.
as such.
Just add that dollar amount for the record. Okay, we have a motion. Is there a second?
Mr. Chairman? Bob Erickson, for the record, I would second the motion.
We have a motion and a second. All in favor?
Aye.
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 None opposed? Motion carries. Darren, congratulations. I think we all echo Larry's thoughts. I think you do know rural Nevada, and in our discussions, I think you understand that the empathizing with what rural Nevadans, how they feel and their thoughts, and especially how they feel about service and one-on-one discussions. I think you're going to do a great job, and your background is fine, so that's not even in question, but the attitude of how we serve out here is different than in cities, and I think you're going to do a great job for these 4 counties and for this one city of Fallon. So congratulations, and we look forward to working with you.
Thank you very much for that. For the record, Darren Winkleman. Yeah, Larry, thank you for the comments. When Larry and I talked a while back, one of the mottos I use is that we're going to educate before we regulate. And I believe that's super important as we move forward in this process, that everybody that touches the Central Nevada Health District, we have an opportunity to educate. And so we have our challenges ahead of us, but I believe probably more opportunities ahead of us. So we're excited about it. We have a great team in place, and we're looking forward to put some meat to the bones you all created. So thank you.
Well, you're sure welcome. We appreciate what you're going to do for all of us out here in these rural counties. It's a real opportunity, being the first one that's put together, and we know now it takes some pressure off this Shannon and Churchill County. So thank you. Okay, you got about 5 minutes before your administrator report, so.
He's not effective till Monday. He gets to breathe through
Caleb
Monday.
doesn't have to do it all. Okay, we'll go to item 9A. It's just a review, but it has a consideration of possible action, but we're not going to have any action on your report, Ted. So Dr. McDonald, September 2023 Health Officer Report.
Good afternoon,
We're not
Mr.
going to grade
Chairman.
you. We're not going to grade you, so.
I appreciate that. Ted McDonald for the record, and good afternoon, everyone. I've got my report in front of you. There's some little additions as we've had a county health officers, state health officers meeting the beginning of this week, and a few other little things that have come along. Our meeting was September 11th, and the things that, the highlights of what we had on that meeting were, we had a report on the crisis response system, the 988 system that was initiated, and they have received their monies. They have received $1.4 million from, I believe it's Verizon, and they are putting out a request for proposals for vendors, and they are also, they expect to have the proposals out for the fall and winter, and then by spring have a vendor. They are also going to be doing a rural hospital visit and rural community visit, because they're going to be looking at where they're going to put their crisis centers. So there will actually be some brick and mortar places where they will have their crisis response teams working at. And as we know more, we should be getting notification of when their visits are going to start. The other is Kevin Dick reported that now it's no longer Washoe County Health District. It's as of September 1st, it's Northern Nevada Public Health. They've rebranded, and they've pretty much finished with that process. So a new name and a new look.
Does it cover more than just Washoe County now?
No, it's still just Washoe County.
Just Washoe County?
Right. Also, we will probably be hearing from, in the local health districts and the Central Nevada Health District, about the Empower Group. It's a group dealing with pregnancy, opioids, and addicted mothers. And they are looking to partner with the health districts and the community health, or community health organizations to partner and find if there's space sharing available to actually have some of their members available in the community working on the opioid issues as related to maternal fetal medicine. I went through the COVID-19. Everybody's aware, from if you've read anything, that there was an increase. They called it a substantial increase. So what substantial means is if you get a 20% increase in hospitalization from the previous week. But if you had hospitalization of 2 people and the next week you had 3, that's a 50% increase. So they're indicating that it's enough where they're looking at it, watching it. There have been no changes in recommendations as far as what we are going to do. There's no masking mandates or anything like that. It's just under observation. Our numbers that I am privy to for Churchill County and for Mineral County mimic that a little bit, in that we did have a rise around the end of August and beginning of September. We did have hospitalizations in Churchill County related, but the numbers are now dropping down. Mineral County was a little bit harder to get things because there just wasn't very many numbers, and I'm not truly sure, is that because we just didn't get reports? Nobody went to the doctor? That's my best guess, that there was, in both communities, there are more people having COVID, they just are not reporting it. I know.
Do you know where you get the reports from for Mineral County? We report to Red Cap, at least employee-based.
Yeah, I get it from the state epidemiology.
So that's a red cap. It comes there.
Yeah, and I mean, we haven't had a lot. I mean, I would say under 10 in the last 3 weeks.
And that matches what's been reported to me.
Okay.
I get a daily report. Okay, so we're there. Health alerts, I've got that there. We did have a health alert. I really appreciate the county mosquito abatement folks reaching out to me. We did have a report that's been in the news where 3 mosquito pools were found to be positive for West Nile virus. The areas have been treated, and we're waiting for the results of the retesting of the pools to make sure that there is no continuation of the virus. So it was recognized early, it was addressed, and I just can't say enough about my appreciation for the mosquito abatement department. They are on top of things. In-house, we continue to work on our pharmacy certification. We're in the process now of making sure that we have all the fixtures that we need to satisfy the state. Our nurse practitioner is, I believe, scheduled to take her testing with the nursing board, and we are in contact with the Board of Pharmacy advisors so that we can expedite this as quick as possible. This relates only to us dispensing medications out of the clinic. So if we gave somebody an oral medication, it doesn't prevent us from giving vaccinations or writing prescriptions and making sure people have the services that they need. I've also talked with Kathleen Patterson, our advanced nurse practitioner, about looking into what the generic costs are for a lot of the pharmacies. Walgreens usually has a generic process where the prescriptions can cost a patient $8. And I'm sure that if that is a burden, the other thing that we're looking at is where can we find a community partner that is willing to sponsor us for emergency medications as needed. We are about ready to order our in-house medications, the stuff that we use in-house for treatment and for diagnosis. And we continue to the process of applying for our Medicare and Medicaid numbers. And thank you, Shannon, for working on that. I appreciate it. August was a busy month. September was less busy as far as our vaccination pods and our outside activities. You have the calendar. For that, October is going to be a lot. We have 3 or 4 vaccination pods. We're going to be going out to Schurz, to the Pine Nut Festival, and working there. We'll be going to Lovelock, Mineral County, Eureka. So it's going to be a busy month. My staff news is, I apologize ahead of time. When I filled this out, I had a trip that I had to make, and I announced that Darren Winkleman has accepted the position. Fortunately, Shannon caught that and said to be offered, and I would like to say I've met with Mr. Winkleman a few times, and we've had coffee together, and I agree that he's the person for the job at this point. He understands where we're at, and he can see where we want to go. Things that are coming, we've been also working on our TB testing and treatment process. We will be taking that on probably, is it October, Shannon, that we're looking at that? So right now, we're just making sure we have the medications, we've got the testing protocols in place, and that we're going to be able to get this done. This is one of our primary functions in the community and other communities. So it's important that we do this. It is amazing how much help we've had from the state in the transition. They continue to make sure that we're there and they're behind us, supporting us if we need extra medications or if there's something they can do to help. They've been offering that, and in the meetings, they've been wonderful about volunteering to help us. We have a meeting next week to continue the TB process, and I believe they're working on our SAFTA loan or SAFTA grant to be able to do that, and they will be backdating it to the time that we all started with this. So,
October 1. It's an October 1, SAPTA.
oh, okay. Excuse me. Thank you, Shannon. So anyway, they're willing to work with us as far as the time frame goes and the monies that we will receive to continue that. I have sent to our providers right now. Next week, the CDC has a class for RSV, influenza, and COVID vaccinations and considerations for the upcoming season. I've also provided them instructions on how to work with the CDC and their educational component to receive free education, and the CDC comes out on a monthly basis, providing the insights that we need for public health. It also gives them a place to go and brush up on their vaccination skills, indications, and reasons to give vaccinations, and also on the different entities, the infectious agents that we will be facing, primarily TB, RSV, measles, flus, and all those sort of things. So they'll have a resource to be able to work with. The other little project that I have is working to disseminate the information that regarding Senate Bill number 172, which expanded our ability to offer testing and treatment for minors in the case of potential sexually transmitted infection. What it allows us to do is it expanded the people that can do it. We now have nurse practitioners can do this, and all the licensed providers can, but the big thing that we were missing is that nurses and nurse practitioners were not included in the previous one. The other was a consideration of, could we do this without parental involvement? And the language of the bill states that we can. If a 14-year-old came to any one of those legitimized providers and wished to have the testing done, was interviewed, found need to have testing, and they were consented properly, they could receive testing and treatment. And there's a whole lot that's, you can imagine there's going to be a lot of stuff that's around that that's going to be a little bit messy. So we actually have to look at how that may look in our system and disseminate this out a little bit to the hospitals and clinics to let them now know that this is going on, and they will need to figure out how to handle the messy stuff around it, like reporting it to the state, payments, insurance, all the things that are connected with that. And that's all I'm going to torture you with.
Okay.
Any questions for me on anything in all of that?
Any questions for Dr. McDonald?
I think if I was going to say our biggest barrier at this point is looking at paying for our medications down the line. They have turned out to be very expensive, and, you know, getting us into a mode where we're billing insurances and able to reach out to to a general public is going to be important. But our primary goal right now is to make sure that we meet the mandate that's been provided to us to provide the basic services. And I see that we're on track for that.
Okay, good, thank you.
Thank you.
We'll go to item 10A then, the September 2023 Administrator Update. Caleb?
Good morning, Mr. Yes, sir. This is Caleb Cage. Sorry, I failed to unmute in time. Good morning, Mr. Chair, afternoon, Mr. Chairman, members of the board. Caleb Cage for the record. I've included an administrator's report that I think outlines the current progress that we're making right now. As upfront in the report, I've listed a number of activities that we've participated in, as well as some feedback that we've received from some of those events are included in the report. Most important, we continue to fill out hiring the team, as you all just participated in moments ago with confirming Administrator Winkleman's appointment to the administrator position. So we included a flow chart here that outlines the positions and where they fall, including the board and other aspects of the agency. We're continuing to hire support staff right now and continuing to work to refine this organizational chart as we go forward here. But it's all part of the growth process, and it's all well underway, and looking very closely to having a very full team of members here for the health district. I'll quickly provide an overview of the funding. As you all know, we have been continuing to pursue competitive grants. I'm excited to inform you that we have been successful in pursuing a grant through NACCHO, which is the national organization, and it's a limited dollar amount. It's only $20,000, but it provides a great deal of technical assistance on everything from writing administrative preparedness plans and public health preparedness plans and the other strategic work that we need to do going forward here. So we're very pleased that we were successful in that. As you all approve and ratify the grant dollars coming in, you're seeing those are continuing to come in, and they will continue to come in throughout the next meetings. And that will be in addition to the generous contributions by our jurisdictional members and the money coming out of the state through Senate Bill 118. The rest is in the report. I'm happy to go into some detail or answer any questions you may have, but that concludes my overview.
Any questions for Caleb? Any questions from the public for Caleb? Okay, thank you, Caleb.
Thank you.
Appreciate it. We'll go to item 11A, which is the calendar for the month of September in each venue. Are there any questions about it? Being none, we go to item 12, consideration of any future agenda items. Does the board have anything they wish to be on the agenda in the future?
No, Mr. Chair, I just want to make note, I'm working with Central Nevada Health District and their fiscal team, so that at the next meeting, we can have a fiscal report come forward. We wanted to come together with something that really could represent and be brief and not 500 pages for you, that shows the grant revenues that are received, expenditures, the revenues that are coming in from those fee-for-services. So we wanted to wait until Mr. Winkleman came on, and so next meeting, that'll be coming before you, and then we'll be looking for comments on how to revise that.
Okay, fine, thank you. Item 13 is to schedule a future meeting date, and that'll be the second Thursday at 1:30 in October,
October 12th.
October 12th. So 10/12 at 1:30. Put on your calendar. Item 14 is for public comment again. Is there any public comment? Being none, we'll go to item 15, which is nothing left on the agenda, so we stand adjourned. Thank you all for coming, and thank you who are on the telephone. We appreciate it.
Thank you very much.
Thank you all.